Well, thank you, Mr. Chairman. Dr. Cooper, today the top three PBMs control 80% of the market. PBMs which are vertically integrated with the largest Part D plan sponsors entice plans to incentivize beneficiaries to use pharmacies that are owned and operated by the PBM. With vertical integration both upstream and downstream, no one is protecting patients from paying too much at the counter. A recent MedPAC presentation indicated that vertically integrated PBMs in Medicare Part D may be benefiting from higher reimbursements to their own pharmacies while increasing costs to the Part D program. This has created a perverse incentive for PBMs to drive up costs for patients and limit patient access to pharmacies of their choice. So, Dr. Cooper, do you agree with MedPAC that the vertical integration of PBMs could be causing patient harm and raising costs?
Thank you for the question, Senator Menendez. I think broadly, when firms gain market power, it's usually good for the firms and not so good for the people who buy things for the firms. And so I think what we have to be cautious about with vertical integration is when all of these parties have market power, it can shortchange the end customer, in this case, the patient. I think it's really important that the FTC is carrying out their investigation of PBMs. I think one of the things that's hard is in antitrust, you can't unscramble the eggs too easily. Once these firms integrate, it's hard to take them apart. And so I think one of the things we need to think about is who regulates the PBMs? What would happen if we said, for example, they had to be a fiduciary for the government and for patients?
Yeah. Well, when you insist on the higher price because you want to get a bigger percentage, you certainly are not helping either the consumer or, for that fact, the government when the government is paying. And so it just seems to me that this integration, there's basically three companies that control everything. How should we address this to ensure that patients who are overcharged for prescription drugs because of consolidation and the anti-competitive tactics of PBMs?
So I think the first, Senator, is increasing competition in the sector. Now, I think it's very, very hard now that it's become so concentrated. I think we need investigations to know exactly what's happening at these different entities. I think the third is thinking strongly about whether there should be some fiduciary obligation for PBMs so that they are really serving the end customers.
Okay. Let me ask you a separate question. Actually, Ms. Pearson, since health care price transparency rules were implemented by the federal government in the past few years, Americans have access to more information than they've ever had about the cost of health care. However, you've observed that transparency around health care prices in and of itself does not significantly impact consumer behavior. Specifically, you've written that simply making prices transparent does not cause consumers to change their providers or their hospitals. What more must be done by hospitals, insurers, and providers in order for patients to benefit from additional transparency?
Thank you, Senator. So in addition to the points I mentioned about the challenge for patients to actually shop for health care, the health insurance structure in our country certainly protects most consumers from the majority of their health care costs, meaning that the actual fiscal impact on any individual family from going to one provider to the other is relatively limited outside of the deductible period. So I think we need to think holistically, not just about better information, but how do we use the tools of insurance benefit design, provider networks, and others to really help guide folks to the providers that are both lower cost and still delivering high-value care.
Thank you. Finally, Dr. Cooper, last year the American Medical Association released a study outlining health insurance concentration across the country. Notably, AMA found that 75% of local markets were considered highly concentrated according to federal guidelines. Further, in 91% of markets, at least one insurer had a market share of at least 30%, and in 48% of markets, one insurer had a share of 50% or more. With increased consolidation, health insurers amass more power in the market, have greater ability to lower payments to physicians. Is it your view that insurer consolidation leads to lower physician earnings and decreased work opportunities for physicians?
Thank you for the question, Senator Menendez. I think the evidence is pretty clear that when insurance companies merge and gain bargaining leverage, they do offer lower payment rates to both hospitals and physicians. In some instances, those can be below competitive rates. I think what it speaks to, and we're hearing this about a lot of the different parts of the health system, is really the need for antitrust enforcement in this sector to prevent it from becoming so consolidated.
Thank you, Mr. Chairman. Thank you for holding the hearing.
I thank my